Hello, welcome back to my channel. My name is Marian. If you have been following me, now we are going to talk about the upper and lower extremities. If this is your first time here, I have been doing the CT registry review for ARRT, and you can use it for your CQR review as well. So for this lesson, we're going to cover the extremities. We're going to talk about the wrist, shoulder, hips, knee, and feet. Indications for CT scans of the musculoskeletal system, you may hear it be called MSK. It's going to be for trauma. It can be used to demonstrate fractures. And the CT scans of the MSK, it also can identify certain type of conditions like cysts, benign tumors, malignant tumors, any type of cancer that has spread it. So over here, just review your pathology for your MSK system. Make sure you know the benign tumors, your malignant tumors. Also, it can be used for inflammatory or infectious diagnosis. You have your osteomyelitis, cellulitis, abscess, know what multiple myeloma is. So it can be used for several different reasons. You also have your foot condition. If patients come in and they are complaining about pain around their heel, and also some things that can help reduce this is exercise. They can lose weight, maybe change your shoes, have a healthy diet. The doctor may have to order some type of medication to reduce inflammation. Majority of the time, they'll start with an X-ray and then may even order a CT or MRI scan. This is a CT of your foot. Just know that this is in bone windows. Know your window width and your window level for your extremities. These are the numbers for soft tissue and bone for your extremities. So just make sure you know that whenever you do send your images over after you have created or done the scan, make sure that it is in soft tissue and bone windows for the radiologist. You have your AP scale, you have your lateral scale. Most of the time, regardless if you're doing a knee, hip, shoulder, you're going to see an AP and a lateral scale just to make sure that you have enough coverage from side to side, front to back. Okay, now we have your wrist. If you can get the patient to lay on the table in a prone position or on their stomach with their hands up, like Superman position, that would be perfect. This will help the anatomy be in the correct position and not superimpose on top of each other. There are times that patient cannot lay in a Superman position, so just have them lay on their back, head going into the machine. Arms can be in a neutral position. Whatever side is affected, if you are scanning their right hand or right wrist, just move their body over a little bit off center so that you can get that affected hand or wrist in the center of the machine so that you can just get all of the anatomy and avoid it wrapping or streaking. And you have your foot, make sure that you know what is all involved whenever you are scanning your forefoot, midfoot. Know which window level you're looking at, soft tissue window, bone window. You have this foot in a bone window. If you are scanning a CT foot, the patient is going to be supine. Have the patient bend up their knee just a little bit. I always have the patient put the bottom of their foot on the table like they're walking on it, kind of like flat on the table. And then they can move the other leg to the side so that the streaking artifact does not occur in the images. And you just have more information regarding how to scan the foot, especially if you are scanning the ankle. For scanning the ankle, I just have the patient lay supine, their leg is straight, toes pointing upward. So just make sure that you are covering the correct anatomy for this, especially make sure that you are getting all the way back to cover through the calcaneus as well. And then this is just your anatomy. Just make sure that you know this information because you also need to know how to pick it out on your test. You need to know what you are covering whenever you are doing the scan. More anatomy images. This is a cool looking illustration. Just make sure that you know your anatomy. And you can always just pause this video and come back to it. For our foot pathology, at the bottom you do have your axial images. Off to the side by itself you have your corona image. Know why it is ordered for fractures, dislocation, abscess. So this is important to know. We have your knee. Whenever your knee is ordered, mainly probably for fractures, dislocations. Just know how much to cover. Be careful whenever you are scanning a patient's knee. Make sure that you are being careful whenever you do have to move them, especially if they have a fracture. Um, if contrast is ordered for your MSK studies, it's mainly going to be for some type of infection, abscess, inflammation to see if a tumor is benign or malignant. So this is different reasons for this. Just make sure that your patient is not allergic to iodine. If you do have to start an IV, I have a lot of IV videos if you need help, if you're not comfortable. So just feel free to check it out in my IV playlist. Just like I said, with this type of study, make sure the patient is not allergic to iodine. And if you're just doing it for a foot, hip, it's not going to be an angio study. So you can have an IV in the hand, in the wrist, in the forearm. It can be an 18 gauge, 20 gauge, 22 gauge. So just make sure that you are aware of your pathology and why it is ordered if it's for an MSK study. For your shoulder, this is a coronal image. You may or may not perform a lot of shoulders at your facility. It all depends on if you're working outpatient, inpatient, ER. There are times where I do take CT scans of shoulder. I think it also depends on what type of facility you work at. But it's similar to X-ray. You see how the picture is, just how you would do it if you have an X-ray, how much coverage you will have. Just make sure that the patient is going in head first, their arms by their side. Just make sure you have their palms up or their hand facing upwards. Make sure that the shoulder is in the center of the machine, especially the side you are scanning. For the unaffected side, just move them a little bit closer to the outside or the side of the machine while they're in the gantry area. And this is because of artifacts. If the opposite side is too close to their body, this can create artifacts, especially if they have a large body habitus. We have the bony pelvis or our pelvic structures. You want to make sure that you know the anatomy that is in the pelvic girdle. Scan the patient in a supine position, feet going inside of the machine. If I'm scanning a trauma patient, just be very careful if they come inside into the ER and you have them on a sliding board. Just be careful whenever you are positioning them. Normally, if I am scanning a pelvis or a bony hip and they do not have any trauma, I have them rotate their toes together and then you can just tape it with Coban or tape so that you can get your greater trochanters in a certain position. Um, so if they're able to do that, perfect. If not, don't worry about it because you're going to cause further trauma to them if they're already in pain. Also, have the patient raise their arms up above their head so that the images will not have any streaking artifacts on it. Another indication for a CT hip other than trauma, car accidents, a fall you may have if a patient had hip surgery. Just checking on how the hip is doing after surgery. So it's just different reasons why a CT pelvis would be ordered. Well, this was a short presentation that I just covered pretty much just over the upper and lower extremities. If you have any questions, feel free to leave them in the comment section and stay tuned for the next lesson. Thank you all for watching my video.